Hello and welcome. This is Pam. Today we're going to be talking about bowel problems in multiple sclerosis. So, with multiple sclerosis, there is a much higher risk of having bowel issues. Things like inflammatory bowel disease, irritable bowel disease, also colitis, Crohn's disease. What's so interesting is that people that are later diagnosed with multiple sclerosis, they will have bowel issues years before their diagnosis. So why is there such a huge connection between bowel issues and multiple sclerosis? Even things like constipation and incontinence. It's shocking how much higher of a risk we have for these bowel issues when we have MS. Well, we'll be talking about this today, why there is such a higher risk of bowel issues with multiple sclerosis, and also what's causing it, and how to treat it, how to recover from multiple sclerosis. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago, and I can tell you firsthand that I had years of constipation, chronic constipation, before I was diagnosed with multiple sclerosis. I was diagnosed at the age of 28. And so this topic is near and dear to my heart because a lot of us, we really don't realize like that could be a possible warning sign of not just MS, but other chronic diseases later on in life. And we just ignore it and we just take supplements to help us go to the bathroom. But we really don't realize that this is a warning sign that something is off in our body. And if we would address it early, if our doctors would help us to address this early, then we could avoid the pitfalls of chronic disease. So what I'd like to do is share some really compelling research with you today, because this research really is so important to share with practitioners, with different doctors, chiropractors, acupuncturists, nurse practitioners, anybody who is in the health field, because they may not be making this link. And this is going to be research that is helping us to go closer to the cure, to the cause, knowing the cause of multiple sclerosis. And then obviously, we don't have to wait for a cure because that could take a long time, but we can start to take matters into our own hands, treating the cause and recovering like myself and so many others have done. So we know that MS is an inflammatory condition or a disease, and we do know that with inflammation, I'm just going to share a couple of key points because this really ties it all together. So multiple sclerosis and all chronic diseases are inflammatory conditions. That means that inflammation is happening in the body, and inflammation is your body or your immune's response to something. It's attacking something, it's going after something, and actually the primary job of our immune system is to defend us from infections, from different types of parasitic infections. And so that is truly scientifically the most important job for our immune system. And so then if we have so much inflammation in multiple sclerosis and other diseases, then there are these theories that, well, maybe multiple sclerosis is an infectious disease because our immune system is working so hard. Another thing that I want you to consider too, that if MS is an autoimmune disease where our immune system is attacking our nerve tissue for no apparent reason, then why do we have all this inflammation in the gut? Yes, they're trying to tell us, well, nerves are damaged in your brain, and so that could possibly affect your ability to have a regular bowel movement. And it's like, okay, that's a theory, that's a bit of a stretch, but what hard evidence do they have for that? They don't. And how is it that many of us that are recovering from multiple sclerosis, we don't have constipation anymore? We are able to have regular bowel movements. So it's more to do with treating the microbiome, as we are going to learn. So we're going to look first at a few studies, and the first one is talking or discussing bowel problems in multiple sclerosis. I'm going to share with you some key statistics and studies. So there was a 2023 Canadian study that looked at 7,500 people that were diagnosed with multiple sclerosis and compared that with over 36,000 people that did not have multiple sclerosis. These researchers found that in the 5 years before the first MS attack, so in the 7,500 people that did have MS, so in the 5 years before their first attack, those who later developed MS, they had a higher risk, 42% higher risk of having issues like gastritis, which is inflammation in the lining of the stomach. It's a 42% increased risk of gastritis or duodenitis. So basically the lining of the stomach or the lining of the first part of the small intestines, those areas were inflamed. So a much higher incidence of people that had inflammation in the lining of their stomach that had MS versus healthy people, or in the first part of the small intestine. So those areas were inflamed, and that would cause a lot of pain, indigestion, and discomfort. They also found that there was a 46% higher risk of MS, these MS patients visiting doctors for GERD, but it's a condition where people have a hard time swallowing. It's inflammation of the esophagus. So again, more inflammation in the digestive tract. So these were all people that had multiple sclerosis, and they had a much higher incidence of, again, inflammation in the lining of the stomach, inflammation in the lining of the first part of the small intestine, and a much higher risk of inflammation in the esophagus. So infections growing where they should not be growing. And we do know that the most common cause, or a really high cause, I mean, sure, it could be tons of alcohol or certain medications, but in the average person that's not taking a lot of alcohol and medications, the biggest cause of these conditions would be infections. They know that in science. And so when people have GERD, they have a really hard time swallowing. They get acid reflux. They end up getting put on medications that actually decreases their acid even more. Their stomach acid is a proton pump inhibitor, which actually is good for the parasites because they don't like the acid, so it actually makes matters worse for people. And they can suffer with things like nausea and vomiting. So this 2023 study, they concluded that GI, so gastrointestinal symptoms, are a common warning sign of multiple sclerosis onset, meaning that if people have a lot of gut issues, like these types and others, then doctors should keep an eye out for multiple sclerosis diagnosis in the future. And then another study I wanted to share with you, a 14-year cohort study. So they reported almost 1/3 of MS patients experienced bowel symptoms, so like poor digestive symptoms, bowel problems, 1 to 3 years before their first MS attack. And this was over 14 years, a follow-up study. Researchers found that the average time between the first bowel symptoms and the first MS attack was under 4 years. Now, I find that really interesting because to me, that sounds like maybe for some people, like it's maybe one type of parasite is more commonly causing MS because they would have had this, becoming infected within 4 years. But for myself, I know that I had years and years of constipation. So I don't know. Maybe that's like the average time is what they're talking about. Pre-MS fatigue and sensory disturbances were strongly associated with bowel symptoms. Maybe let me know if you had any digestive issues years before MS. Let me know if you used a lot of antibiotics. Like, this is where we can have some good discussions going in the comments section, and people can share, like for myself, I would have a bowel movement once a week, right? And that is not good. And I was reading, of course, what the medical sites say, and they're like, oh yeah, well, you don't have to have a bowel movement every day. That's not necessary. Once every 3 days is fine. But, maybe if it's like once a week, that's not often enough. But honestly, it is super important to have daily bowel movements. It really is, because when your body has taken all the nutrients out of your food, that waste should not be staying in your digestive tract. It should be released. You don't want it to be, fermenting more and providing food for different types of bad microbes. You want it to be going out. So let me know if you're one of the, 50% or more of people that are dealing with different types of bowel issues, digestive issues, if you have multiple sclerosis. So over a 14-year follow-up, the researchers found that the average time between the first bowel symptoms and the MS attack was under 4 years. And I said the pre-MS fatigue and sensory disturbances were strongly associated with bowel symptoms. So again, very strong, compelling research on that. And then another UK study revealed that constipation affected 29 to 43% of MS patients, while fecal incontinence affected over 50% of MS patients. So over 50% of MS patients are leaking stool. They're not able to hold their bowel, their stool. That's a really awful thing, right? It's awful. Many participants noted that bowel management significantly impacted their quality of life. Well, of course it would. And it was so dramatic for them that it was really comparable to the mobility issues that they dealt with MS. It's interesting. I don't know, let me know, does your doctor care about this? Do they ask you about this? Because it seems that it would be a really awful thing to have as a person if you're dealing with that incontinence. And so it said, yet effective management strategies were limited. So now I wanted to just share some common GI symptoms, so gastrointestinal symptoms in multiple sclerosis. So this is what's being reported. Report at least one of these symptoms lasting 6 months or more. So this is other research that shows that these symptoms are really common in multiple sclerosis. So difficulty swallowing and heartburn, nausea, abdominal pain, bloating, diarrhea, incontinence, and that's the fecal incontinence, and also constipation. So the link between multiple sclerosis and inflammatory bowel disease is pretty significant also. So that's things irritable bowel, but also colitis and Crohn's disease. There was a 2017 review. They looked at a lot of different studies, and it showed that multiple sclerosis and inflammatory bowel disease showed that MS and inflammatory bowel disease patients were 50% more likely to develop the other condition. So if you had inflammatory bowel disease, you were 50% higher risk to develop multiple sclerosis. But if you had MS, you had a 50% higher chance to develop inflammatory bowel disease, which would be things like colitis and Crohn's disease. So that's interesting. So not everybody that is diagnosed with MS would necessarily show the inflammatory bowel disease, the full, you might have symptoms of gastrointestinal condition, but you might not have a inflammatory bowel disease until after your MS diagnosis. It could go either way. 2024 German study reported that Crohn's disease and ulcerative colitis patients had a significantly higher risk of developing multiple sclerosis within 10 years of diagnosis, with male patients showing a stronger association. At least 20% of MS patients with irritable bowel syndrome, that's more than double the rate in the general population. So what's causing all of this? What is causing us to have all of this inflammation in our intestines, in our digestive tract? If we talk in the medical arena, it's just, inflammation is all part of disease. We don't really know what's causing it. Your immune system is kind of attacking your own tissue. We really don't know why. We have over 80 autoimmune diseases where our immune system is just attacking our different parts of our body and tissue for no apparent reason. We're not moving anywhere with our healthcare system. We're stuck, we're gridlocked, and we're stuck in this way of thinking that there's nothing we can do. We just have to suppress the immune system because for some reason the immune system has gone haywire. So that's one world. That is our standard of care. And then you can look at this whole other area where there's science, where there's research, where there's common sense, and they know that many different parasites cause all kinds of inflammatory conditions in our digestive tract. Worms, protozoa, bacteria, fungi, all these different types of microbes. I call them parasites because they live in us, they cause us harm, especially if they're in higher populations than they should be. And so there's tons of research showing that they cause inflammation, they can cause blockages, they can cause compacting of our stool, like diarrhea, incontinence. They're linked with all of these different conditions. And yet there's a disconnect between our healthcare providers and I'm not blaming the doctors at all, because they're taught that there is no connection. They're told. I have a very dear person in my life who is working in a hospital, managing a hospital, and she's like, well, we really don't see a lot of parasites. Like well, you don't, because you guys aren't looking for parasites. We don't have good tests. The doctors are not trained to identify parasitic infections. So the problem is, like, of course you're not going to see them if you're not looking for them. So that is a huge, huge concern, is that, like, how are things going to change? How are things going to change? That is the big question. So while some experts, they do attribute all of these issues in MS, this inflammation, to disruptions in the communication system of our nerves, because nerves get damaged in the central nervous system, and then you end up, they're like, well, you have damage in your central nervous system, so you're going to have constipation all your life. Well, that's never been proven, and that is just an assumption. That is just a convenient assumption. And again, there is tons and tons of evidence. I've shared with you the findings of Dr. Alan MacDonald, who found small roundworms in the central nervous system of every MS subject he tested. And we found, like, the dysbiosis in multiple sclerosis, the tapeworm larval cyst. So he was looking in the central nervous system, and he found tapeworm larvae, developing tapeworm. They've also found other bacteria, Borrelia, over 100 years of research, protozoa. We know that the central nervous system is not a sterile environment. So do you think that if there's worms and bacteria and protozoa and fungi in the central nervous system, do you think they're in our gut, where that is the ecosystem with microbes? That's where we carry 2 to 3 pounds of these microbes. Yes. Do we have evidence that our students that are recovering from multiple sclerosis, they are passing tons and tons of worms? I probably should have shared with you a picture. I will again in the near future, but I'll share one of our students' successes this week. It's pretty crazy, but he has passed several worms that are over 3 feet long. And that is just so common, like to have worms that are 1 foot to 2 feet to 3 feet. And those are the parasites that we can see. So our students are passing tons and tons of parasites. It's really shocking how infested we are. Like, you would think we would not be able to be alive with this many parasites living inside of us. But when people are releasing them, they're dying and they're being released, it's like completely life-changing. So if you don't believe that we have these parasitic worms, I invite you to go to our website, livediseasefree.com, go and look at some of our blog posts there, or do a Google search of large parasitic worms in multiple sclerosis, and Live Disease Free. That's our website, livediseasefree.com. You'll find that. Intestinal flukes are another nasty type of worm. Tapeworms, I'm sure some of them are tapeworms. We can't really identify them from, we're not skilled parasitologists, but some of them look more ribbon and flat. That would be, and segmented, that would be a tapeworm. And if it's more round, like a pasta noodle, that would be more of a roundworm. And they can be really big, and they can cause a lot of symptoms. So the protozoa are definitely an issue. Borrelia is definitely an issue. But if you have 100 or 200 of these larger worms in you, Do you think they can cause more damage than small, tiny little protozoa? Absolutely. And that's what we're seeing. So when you look in the scientific literature, it's really known that protozoa, they're more commonly associated with things like diarrhea and other intestinal issues. They can definitely cause constipation too. The worms are definitely more linked with abdominal pain, constipation, and sometimes obstruction of the intestines, like blockages. So they can cause abdominal pain, they can cause diarrhea or constipation, bloody stools, rash or itching in the rectum, fatigue, weight loss. Weight loss is another thing, right? If we're going on a low carb diet, we have to make sure we eat a lot of calories because these worms will eat a lot of our nutrition. So these symptoms mirror a lot of what we're dealing with multiple sclerosis, with all these bowel issues that we have with MS, whether it's irritable bowel or whether it's inflammatory bowel conditions. Yet again, there's so little interest in this. Like our doctor, like we might say, he might be checking us, doing a checkup with multiple sclerosis, and we say, well, I have terrible constipation. I'm going to the bathroom maybe once every few weeks, and he'll be like, well, just get a laxative from the drugstore, or I'll prescribe some Senecot or something like that. It's just like brushed off, like it is not to do at all with the disease. And yet it is so awful when you don't have a bowel movement for weeks. It's awful. Or if you are out and about and then you're just leaking stool, even if you're wearing Depends, it smells. It just smells terrible. So it really impacts people's life, and it is really pointing us to what is causing multiple sclerosis. And this is what we want. We want to know what's causing MS because we want to treat the cause. We want to recover. We don't want to live on disease-modifying immunosuppressive drugs for the rest of our life. Do you agree? That's what we want. And we have to start demanding, and it's only going to come from the bottom up. Number one, it's going to come from people like you sharing this information with other groups, with practitioners. We have people all over the world that are practitioners that are starting to see all of the research that I'm doing, and they're really excited about it, and they're embracing it. They're getting their patients to start lowering their carbs, and they're noticing significant symptom improvements. I'm going to share that with you in a minute. They're also starting to treat parasites. Before it was all about Candida and Borrelia, Lyme disease, and now they're like, oh, I guess the herbs are not enough to treat all of these worms, these really big worms, and the larvae that are in the central nervous system. No, we have to use an integrative approach of parasite drugs, herbs, and oxygen therapies to really get the job done. So tapeworms, abdominal pain, nausea, diarrhea, constipation, roundworms, again, abdominal pain, nausea, vomiting, alternating between constipation and diarrhea. There's that incontinence, right? Bloody stools. And then H. pylori, which is really linked with all of this GERD and stomach inflammation and acid reflux. We don't need proton pump inhibitors. We don't want to decrease our stomach acid. We actually need to increase. Talk to your practitioner about that. We have a shortage of stomach acid, and then that is why the bacteria is starting to grow, and that's because we've been in a chronic state of inflammation. Then our stomach acid goes down even more quickly than just us getting older. And then there's these flukes. They are so pro-inflammatory. I know firsthand because they have been one of the biggest causes of my symptoms in the past. And I don't know if they're intestinal flukes or liver flukes. I think they're intestinal for me. They're quite large, but they cause a lot of abdominal pain. They can cause diarrhea, but they can also cause constipation. They cause edema. They can cause all kinds of other neurological symptoms. Giardia is another one. Terrible. It's really common in North America. Stomach cramps, bloating, nausea, diarrhea, but also in chronic cases can cause constipation. So there are numerous, this is just easy to find research. You just look up these parasites, and they're linked to, can they cause compaction of stool? Yes, they can. Can they cause constipation? Yes, there's study after study after study. And yet, so we have all of these issues of constipation, diarrhea, fecal incontinence, gas, bloating, all of these digestive issues years before the MS and while we're dealing with MS and other chronic diseases. And we know that parasites cause all of this. And then the third part is we know that parasites are in every country. Otherwise, we wouldn't have to treat our pets, right? We would not, they're everywhere. They're in our soil. They're in our pets. If you eat in a restaurant, they come in on produce from other countries. They're on our produce. So it's part of life, but we have ignored it because we've ignored parasites in humans. This is why we have so much chronic disease in humans. There is this huge link with bowel problems and multiple sclerosis and other chronic diseases. We know that there are parasites in our environment. I have dogs, we have sheep, we have horses. We have to treat them for parasites regularly, but we don't treat ourselves. Does that even make sense? So we know that they're in North America and developed countries, in every single country in the world. We know what symptoms they cause. They cause all the bowel symptoms. And yet the people that are the experts, the ones that have put together the McDonald criteria, that are running these associations for different diseases, they're not interested in infections, in parasites there. And why is that? Who is funding them? Oh, it's the companies that are selling the disease-modifying maintenance drugs, that immunosuppressive drugs that we have to take for the rest of our life. Oh, they're supporting, they're financing, they are influencing how we are diagnosing and how we are treating MS and all chronic disease. Oh, that's why, because it's not in a financial best interest to treat parasites. And that's why we're stuck. So you get two options. You either live in that system and you carry on and you keep taking the disease-modifying immunosuppressive drugs and you become more and more disabled, or you do your own due diligence, you take charge of your health, you become your own healthcare advocate, you learn how to work with your practitioners in a partnership way. You're looking out for yourself, for your best. You start to learn from me. You start to learn about the different types of infections that are involved. You start to change your diet. The Live Disease Free diet is on our website, livediseasefree.com. It's free. You can go there. You can print off the cheat sheet. You can get the right foods in the house. You can watch all the videos there about what I eat and what you should eat and what you shouldn't, what feeds the parasites. And of course, take a supplement to make sure you are having daily bowel movements. But with the diet, you're going to notice already that you're feeling a lot better, because when you decrease the food to those parasites, you decrease the carbs, you will be going like, oh my gosh, like what is happening? I'm feeling so much better already. Yes, they do make you crave sugar and carbohydrates like a drug addiction. So are you going to let them have their way with you, or are you going to be the one that says, no more, I want my life back. This is my year. I'm taking it back. So start with that. And then when you need help, if you need support, if you can't find a doctor that will help you, this is what we can help you in the Live Disease Free plan. Watch my free training. Once you've done watching that, you can book a time to chat with me to make sure it's a good fit. And I would love to support you. And I'm going to share some amazing successes of students that are on that journey right now. So this is one student. So he followed the prep phase of the Live Disease Free plan. He started treating, and he's using these oxidizing enemas that I talk about that I can't share here, but it's on our website, livediseasefree.com. You can look at oxygen therapies and treating MS. You'll see them there. I can talk about it there because I have it on, not on YouTube. I have it somewhere else. Anyhow, he is passing worms. He's like, they're getting bigger and bigger and bigger. And this last week, he's passed several, or I'd say week and a half, that are over 3 or at least 3 feet long, which is crazy. And he shared, I'm sleeping better. My right hand that has had pins and needles for over a year is starting to gain feeling again after passing those large worms. So he went and had a colonic done. And this lady was very gracious and let him put this oxygen water into the colonic machine. And he passed 2 really large worms. He said, the lady that did the colonic noticed that I passed 2 worms that were 3 feet long. They were longer than her viewing tube. And I also passed a lot of other ones that were smaller than those 2. It was insane, he said. And then at home, he sent me a picture. I tell my students, like, we need to be scientific. So when you pass the worms, you need to lay them on parchment paper or tin foil. You need to put a ruler or tape measure beside them. They're clean. It's really easy to see them. It's really good for doctors and healthcare professionals to see this evidence. I get like this worm hanging over a counter. He's like, sorry, I didn't have anything there. And he puts his comb beside it, and it's like a 3-foot worm hanging all over his counter. It's like just disgusting. Anyhow, hopefully he disinfected it really well. But it's like giving him his life back. It's so incredibly crazy. Another student shared, and she's just been getting ready to treat, and just with the prep phase, which is the live disease-free diet and supporting the body, making sure we're having daily bowel movements and we're sleeping, she has reduced her baclofen gradually from 30 milligrams to 10 milligrams at night, and she expects that she can stop that altogether next week. So we don't have to stop taking our medications when we follow the Live Disease-Free plan, but as people are getting better, as their symptoms are improving, they are working with their healthcare professionals and they're decreasing their medication safely. And of course, with pharmacists, they're helpful too. This next student shared that I joined the program in December. I've been following the low-carb, Live Disease-Free diet that you recommended, and the results have been very promising. So he hasn't started treating yet. So again, these people all have digestive issues, constipation like crazy usually, or incontinence, or a small number of them have diarrhea before they start treating. So one particularly troubling symptom that he used to have was severe leg twitching, especially at night before bed. I vividly remember reading a bedtime story to my kids while struggling to control my involuntary kicking leg. Remarkably, this symptom disappeared within just 3 days of following the Live Disease-Free diet. It was incredible, and it brought tears to my eyes. I've been actively working on my health for some time, even before he started this program. I've taken steps to reduce all of the EMF and RF radiation exposure. He also got an ozone generator. He's been using red light therapy. He's tried different diets. He tried paleo. He tried the Walls protocol. He tried autoimmune. Despite my efforts, I always felt something was missing. Your perspective on infections is truly the missing piece of the puzzle for me, and I'm so grateful for the knowledge and clarity that you provided. I am excited to see what happens once I start treating the parasites. I'm ready to begin. So it's crazy, like when our students, especially the students that have MS that are maybe not as disabled as some of the other students, they're like, well, I might have some worms, I might have some parasites, but probably not that much. And then they go through the plan and they're like, oh my gosh, my husband and I could not believe what's coming out of me. Like, I just cannot believe it. Like, they're just horrified. Like, you get desensitized. These worms are dead. They don't hurt. That it's so funny because I hear this over and over again. And it is so exciting when you actually start to see why you're feeling so terrible. And I always I'm researching all the time, and I know that they found that the protozoa, the malaria, Babesia protozoa in the early 1800s, 1900s in MS, and Borrelia years ago too. And yes, they should not be in the central nervous system, and yes, they can cause all of those symptoms. But man, if you have 100 or 200 worms inside of your gut, they're going to cause a lot of symptoms, neurological symptoms, brain symptoms, mobility symptoms. Also, it is so shocking. Yes, we still do have to treat the smaller parasites, but it is so shocking how many parasites people have. And because we're in the trenches with these students, we see how infested we are. Like, it's really quite shocking. It's actually so disappointing because this is something that our healthcare professionals should be helping us with. This is something that they have missed the boat. they have fallen short. And sure, they can say, well, I was never taught that. But once you hear this, if you're a doctor, if you're a healthcare professional, it is your responsibility to make sure that this is not what your patient is dealing with. Otherwise, in my books, it's negligence. Because if it could be so simple to treat a person with, 3 to 5 parasite drugs over several cycles, and they get their life back, and they don't need medication in the future, and they don't have bowel problems in the future, they don't have mobility. Like, if you're a healthcare professional, that's what you signed up for, right? First, do no harm, and first help people to recover, not to live on drugs for the rest of their life and to suffer and to die prematurely. I'm sorry, but it's just, I get really frustrated. I get on my soapbox. Anyhow, another student, these are all anonymous because these are students that just sent this in just a couple of days ago. Like yesterday, we had our live Q&A call. These are not all of the emails that I got in, the successes. These are just a few. So this student shared that when I started the Live Disease-Free plan in October 2024, I was in a state of constant numbness, tingling, and fear of going into paralysis. So she had multiple sclerosis also. Everything that would startle me would send me into paralysis. And I find that really interesting. Like, why is it that when people that have MS, when they get really stressed suddenly, that one of their limbs can go just hard, straight, can go into like lock up. It's just really crazy. So is that the parasites responding to our stress hormones? Is it, just like over the top inflammation in our body, like adding the stress hormones into it? But the stress hormones probably have something to do with it. Everything that would startle me would send me into paralysis. I was so nervous. I was so nervous I'd move too quickly, even playing with my dogs, that it would put me into spasm or paralysis. I work in a school and I had to take a leave of absence because I couldn't care for the kids. If a child had an emergency, it would send that stress into my body and she would be at risk of having that paralysis. My first month in the Live Disease-Free plan, I improved dramatically with the diet, the Live Disease-Free diet changes. I was less irritable and the symptoms only became tingling and burning. So her other symptoms of the paralysis must have settled down. I then did my first round of treatments and passed so many parasites, so worms, because she could see them, right? We can't see bacteria, we can't see protozoa. I couldn't believe it, but boy, did I feel so much better. I'm still treating, but I'm no longer afraid that I'll spin into paralysis. I don't have constant burning and tingling anymore. I can live a normal day to day, and I'm actually going back to work, going back to my job in school in a couple of weeks. I play volleyball and I run, and last fall I was having such a hard time. My legs would barely move for me to play the game I love, and now I'm back to running, and I know that I'll be able to play volleyball in the same as I did before. Just looking forward to the next session. Awesome. Looking forward to the next season of volleyball. Amazing. So these are just all right, I'm not done here. I'm so incredibly thankful for all that I've learned from you. Thank you again. May God continue to bless you and your work and your family. Another student, just with the diet, my joints continue to be quite good, little to no inflammation. Urination continues to improve, about half of getting up less than half of what she did before. Good sleep. And then her eczema on her hands is going away. So this is just with the diet. It was pretty bad, rashes, bumps, and patches, discolored skin. Feels like it's going away for good. She's had that for 30 years, tried all kinds of different treatments and worked with different consultants, and it's going away. So here's another one that's great that I wanted to share with you. So she is recovering from MS. So today I had a surprise visit from some friends, and we sat and chatted for an hour and a half. After the visit, I was not tired or fatigued at all. This is a new discovery for me. Also, all week long, my toileting transfers have been safe and strong, and I'm getting more confident in my ability to stay strong while treating. And also will probably start on the next treatment cycle right away. Another student shared, thus far I've continued on the diet and I'm doing better and I'm sleeping and I'm feeling better overall, better sleep, no pain throughout the day, really a lot more energy. And that's even while she's treating. So she is passing a lot of different parasites. I get these every week from my students. They send them in every week, and it is so incredibly exciting to hear their successes. I absolutely love it. And this is something that you can do too. You can be a wellness champion. You can start treating. This is the life that you should be having, is getting your health and your life back. So this is a student that joined, and she has, I didn't even know about this disease. It's called Charcot-Marie tooth disease. They say it's hereditary, but she doesn't have any family history of it. And she had negative tests for the genes that they say will cause this. So this is where, is it hereditary or is it parasites? So I always like, if you have a lot of symptoms of parasites, just treat parasites and see how far you can go. So the doctor said that, looks like you don't really have any evidence that, that you got the genes or that you have any family history, but this is probably what you have. So she joined the program. She used to have symptoms, a lot of nerve pain, which would move around in the body, also muscular atrophy, hand and foot coordination and strength was lacking, drop foot. So a lot of symptoms that we would see in multiple sclerosis or other chronic diseases. And sleep was also a huge struggle, waking up several times at night with terrible leg cramps and tremors. She had also had a lot of tremors, numbness, itching, general pain. And so we're told that we have to live with this for the rest of our life. Usually could fall back asleep, but struggled to wake up in the morning. Had trouble swallowing, again, slurred words, so couldn't speak very well. Eye problems, one eye remained, my right eye sometimes would remain closed after and then would open, and her face was slightly drooping. So just poor girl, like suffering with so many different issues. So she said that she didn't get that, remember in the last couple of years, we all were supposed to get this something, and she didn't get that one. But when she was training to be a police officer 20 years ago, she was in the police academy, and she did have multiple vaccines back then. Didn't know if that impacted it. She just shared that with me. But so she's been going through the prep phase and just getting ready to treat. So this is getting the bowels moving and getting sleep and getting the carbs really nice and low. And she said that just the sleep aid has really helped her out a lot. She says she still has leg cramps in her sleep, but the other symptoms, the itching, the aching, and tremors are better. The tremors, which really freaked her out because she felt like she was having a seizure in her sleep, they are completely gone with diet. Tremors completely gone. And she said, my legs do feel better. The diet has completely taken away the trouble for swallowing, which may have been GERD issues. And her tongue no longer gets tired. Even after talking for a long period of time, my fatigue is better. Not fantastic yet, but better. Also, she doesn't have the twitches very often, and which would occur multiple times in the day all over her body. Her eyes still does not cooperate in the morning, but that is huge. So like a genetic inherited disease that she can do nothing about, and just by starting to change her diet, she's proving to herself that she's dealing with a parasitic infestation. And as she starts to treat, she's going to have a lot more symptom improvement. I just absolutely love these stories, and this is what I get every week, and it just incredibly warms my heart. So with that, I'm going to let you guys go. If you like the work that we do, please like, share, and subscribe. Help us to get the word out. And if you do need support, make sure to watch my masterclass training, or maybe you just want to understand the steps of what we do to recover. Just watch my masterclass training And if you are interested in becoming a wellness champion and recovering from these parasites, if you need a proven plan and support, I would be honored to support you. So with that, have a wonderful week. Take care. Bye-bye for now.